Welcome to Let Go, Let EFT, where we are learning and leaning in with you, with your hosts Michelle Puster and Dr. Laura Spiller. EFT is a beautiful model helping people connect with themselves and the people that matter the most, developed by Dr. Sue Johnson.
Hi, Michelle.
Good morning, Dr. How are you?
Good.
Are you ready to talk about getting close to people's emotions, especially when it feels risky and difficult?
Absolutely. It's come up a lot in my supervision meetings with supervisees, this sense of being kind of stuck when it feels risky or dangerous to lean into a client's emotion when it seems hot, or potentially explosive, but also potentially that fragility feeling like this is going to hurt them. They're going to feel really significant pain.
Right. I mean, it feels like there's several different kinds of clients and probably more than we'll even name here, but that sometimes just the clients that are so good at keeping that distance and wall up. Other times, like you said, the clients that feel very fragile, where you can tell it just sort of be this feeling of they're just keeping it together. And it feels like I'm going to go in and shatter the glass that they're trying so hard to just, fragilely keep it together. And like you also said, the heat, the ones where it's like, hey, I'm managing my anger. And if you come close,
Yeah.
going to be able to manage it anymore, and it's all going to come out. It's going to be hot and messy, and there's going to be fire. So yes, it feels like there's lots of times when it feels really hard to move in, to get closer to those big emotions, when people are doing their best to sort of manage them and kind of keep themselves at a distance from their emotions.
Yes, right. I can feel, as you talk about that risk, I can feel that even in my body, that sense of dangerousness. And especially as you're talking, I'm getting the picture right. Sometimes we do try to move aside a client's protection, right? And it does have an important purpose. And that can feel risky, that we're kind of trying to move some of that guard aside to get to the really messy stuff on the inside that's scary to them. And in a lot of those moments, it's scary to us too.
Right. Yeah. Yeah. You're just talking about the self of the therapist piece, right? What makes it's hard with clients because they set up really good blocks. They have lots of good strategies. Sometimes they're I don't know about you, but clients will tell me like, oh, I don't like coming here. I feel anxious the night before. We dread this, and they keep coming. So you can tell they're getting something from it. And even in the moment, why do we have to do this? This is so hard. I don't want to talk about this stuff. And that's actually the easiest because it's most like they're just being honest about it. Right. That's the most explicit when it's like pretty obvious that lots of people feel that way, but they just aren't saying it. Yeah. And so clients throw us up lots of blocks. And then of course it's hard for us too. Like you were talking about some of the self of the therapist blocks. Can you say a little bit more about that when you said that, the activating?
Yeah, I think it does activate our attachment system. Here we are in a relationship that matters to us with our client, and they're feeling something unwanted and difficult, and what has our training in life from early on taught us about what we're supposed to do or not do when someone else feels pain? Most of us have had very good programming installed that when somebody else feels pain, you're bad for causing it and you need to make up for it in some way or back away, right? Or kind of the protector type of role kicks in. You have to take care of them, keep them safe, cheer them up, be their life preserver in these deep and stormy waters. And that's just a really automatic framework that kicks in.
Right. Like what kind of, to the first point, like what kind of therapist would I be if I make people feel worse? Right.
Yeah.
And that is what we're doing, right? To get into the heart, we have to get into the hard stuff with them, which does make them feel worse initially. And certainly we want to protect people. We want to protect people from feeling bad things. And so sometimes we can kind of align with them in their, let's not go there. Let's keep the distance. Oh, that does seem dark and scary.
Mm-hmm.
Like you're right. Let's stay over here where it's like more manageable. And so, yes.
Let's look on the bright side. Let's, talk about how those thoughts aren't true.
Right. Yes. And when we have the courage to move closer to people's emotions, we feel it in our body. Where we start to feel the dysregulation that they feel. We start to feel, potentially our heart rate go up, our uneasiness inside, the anxiety, the pit of your stomach. And in some ways that can help be a tool, because we can check in. Are you feeling this? Gosh, as you're saying that, I'm feeling so much in my chest. I'm feeling so much heaviness. And that can be a tool to help us see if we are aligning with them as we're walking closer to that pain. However, it can kind of, if we're not aware of that possibility, it can freak us out, and it can make us say, gosh, this is like, well, let's get out of here. This is dangerous territory.
A lot to feel in our bodies when we're resonating with deep pain in our clients.
Right.
It's a lot to feel. And I hear you beautifully describing how we can use it to attune. If we're running the client's experience through our body and kind of giving it back to them in our nonverbals and in our validation and in our sharing of our experience, we're, helping be in it with them. That can be really great, but that is such a learned thing. I mean, it's such a learned thing to feel all this kind of painful emotion and lean in and offer it to another person who's in pain. I mean, that's kind of goes counter to what most of our conditioning and our learning experiences and the protection that we've developed to keep ourselves safe.
So I think it begs the question, why are we doing this? Why are we leaning in? Why are we making people feel difficult emotions when it's difficult for us to? Like, why would we do any of this? Why don't we just talk about what's going well? I know you have a great answer for this.
They're already alone with this terrible pain.
Yeah, it's there, whether or not we're talking about it. It's there, whether or not they're talking about it.
Yeah.
And they're already alone with it.
Thinking of George Fowler's question, and I've heard it from Ryan Rana and James Hawkins, who is with you in that dark, painful place?
Yeah.
Right. For most of us, it's nobody.
Right.
It's there. And if we're not talking about it, they're alone with it. If we're, I think you said it when, if they're not talking about it, then they're getting the message from us too, that maybe this is off limits.
Yeah. Yeah. One more person that's going to sort of say, yeah, let's not go there. And we also know that this pain that they're alone with is driving their behaviors. It's driving their feelings about themselves, their relationship. And so it's not just quietly hanging out over here, not having any impact, right? It's having an impact. And oftentimes the clients don't even realize that, which can be really dysregulating and frustrating. Like they don't understand why things are going the way they're going. And so that alone can be helpful, right? Is just to make sense of, oh, this is why I do that. Oh, and so not only, do we give them an experience of not being alone with that, but then they start to have an understanding of their actions and feelings and behaviors and where those are coming from, which is regulating, right? Which is calming and regulating and helps make sense of their experiences.
Yeah, I really appreciate you saying that, because I think that that's a good distinction between what we do with this in stage 1 versus stage 2. In stage 2, hopefully we've set, we've been practicing it. We've been coming close to their emotion, and we're going to really go very deep, and we're going to walk around in it, and we're going to, really get to know it. But as you're saying, in stage 1, we want to help them see that it's there, put words to it, and see what they're doing with it and how what they typically do with it impacts their partner. Sharon Chapman talks about the target working zone, of helping them see what they're doing with their vulnerability and how those moves are impacting their partner. And that's kind of our, a good stage 1. And if we, aren't going towards it, they're not going to be, aware of that. We're not going to help organize that for them.
Right. So the next part is the how. How do we do this as therapists? And I think we started with the why, because if we can get to the how, it's a little bit easier if we really have a good sense of the why and not leaving people alone with this. But the how, of course, is really helpful as well. So what's one way? I'm sure there's many, many hows, but what's one way that you sort of...
Yeah, we could talk about this again for multiple, episodes. And I was thinking maybe first too, like, you have a how, I think, that really helps you bring that why into the room, that helps you kind of ground and be able to take the risks that are necessary. So maybe why don't you want to talk about that, kind of how you ground yourself in the meaning?
Yeah, I like to use my imagination. And that really helps. I picture people in that alone, dark, scary place. And it might not be what they've described yet. It might just be whatever I have in my mind's eye and oftentimes there'll be children, because it's really like, it really draws out our empathy and compassion, right? When we see a child. And oftentimes people's experiences did come from when they were children, but certainly they're had them as adults as well, and in their relationships. So whatever fits. But I like to try to really imagine people in that dark, lonely, scary place. And as vivid as I can. Are they in a dark place in the woods where their imagined monsters are going to come out and get them? Are they in a dark, scary room and they're kind of huddled up in a closet by themselves? Like something that really evokes my empathy and really wanting to go to them and not leave them alone in that place, and know whatever is seeing or hearing on the outside, whether it be anger or fear or whatever it might be, that's completely understandable. And I can empathize with that too. And I can still take a step closer. And you talked about you doing it explicitly. Can you say more about how you explicitly talk to clients about this?
Yeah, I think that it's helpful to let them know what's happening. I don't remember which trainer talked about the dentist analogy. It's probably from the Leading Edge podcast, but the dentist tells you, hey, I'm going to poke around here, then I'm going to give you the anesthesia, and then you should feel this, and then this is what's going to happen. And I think with this, it's really helpful. If it's a reactive, angry client, you sound angry. I want to know about that. Can we slow down here? Right? I'm going to ask you to talk to me. I want to know about your anger. I want to know what's bringing that up right now. Depending on the client, I might say, I know when anger comes up, I know it has a purpose. I know it's trying to tell us about something important that really matters to you, that someplace tender has been touched and that anger is coming up to fight for that. Will you slow down with me for a few minutes here? And I think that's even more, it's helpful for session control when the client is kind of reactive in an angry kind of way. But then also, one of the hard ones when you have one of those clients that just is so tearful and you see their pain and you kind of feel that sense of fragility. It's like, if I touch this person, they're going to fall apart here. I think it's especially important there to I am with you. This is so painful. Nobody's been with you before. Yeah. I know you're feeling that desire to kind of just shrink in, change the subject, go away. But if we do that, I won't know you here. You won't have a chance of being known or accompanied here. So can we spend just a minute or two? If it's too much, you can let me know and we'll do that part together too. But I'm going to be here. I want to be here with you to learn about it. Can we spend a minute or two in this sadness?
Right. A minute or two, that making it explicit for them. I get that this is hard. I don't want to leave you alone here. And also you're saying like, hey, we're not going to spend 15 minutes here. We're not going to, you're just being very explicit and saying 1 or 2 minutes. And you're giving them permission to say, no, too much, not going there. I'm already at my edge. So I think that's a really nice way for us to make it more palatable to get closer to people's, deep emotions. And also it makes it a little bit safer for the client to know, like, we're not going to hang out here in forever. It's going to be a minute or two. It's okay. Like, we can do this together, and it's okay to say no. It's okay to say we've already gone far enough.
Yeah. And I think we have to respect that too. If you've been, talking with them and keeping them in it for a minute or two, again, kind of making that explicit too. I mean, being praising is so good. You're sitting with this, I can really see how you're letting this wash through your body and you're feeling some of this. And then using some of our interventions that kind of walk us up the emotion. We talk about deepening, but we have to be aware of which of our interventions kind of help us walk up the ladder of emotional experiencing also. And so I might ask a more cognitive question, what's the urge that would come up usually here when you would start to touch this? What might you usually do? Because I do want to be respectful that I've asked them for a minute or two.
Then you want to, right.
For that, right.
Yeah. I like that.
Next time I can do a little more.
Right. Because they've had a safe experience of it. And I mean, I think it is fair to say, like, it doesn't feel better in the moment, but it feels better afterwards. It's at some point, it feels better to have not been, to have touched that and not been alone in it. And, it's kind of like, it makes me think of when a child scrapes their knee and they're kind of like a little bit of shock. And then the parent comes over and then they just break down, and the tears just come. And, objectively or from the outside, it might feel like, well, they feel worse when they're like crying so much. But, I think we all see that as like, yeah, they're grateful someone came. They're grateful they can just cry. And then they get up and run off and go play. And it's very
receive comfort.
Right. They've moved through that cycle because they've had someone be there with them. And so I think we can hold that in our mind's eye of like, we're with them in the really painful part. And yes, it might look like it feels worse. They might describe it as feeling worse, but it does feel better at some point, maybe later that day, maybe before they leave, to have someone feel that with them and to not be alone in that. It does feel better. So I think that's helpful. It's just helpful to have that in our mind, that this does feel better to not be alone in this pain. We're not taking away the pain. That's not what's happening. We're not taking it away. We're not taking away the feelings of it. We're just giving them an experience of not being alone in it, and often of making sense of it too.
Making sense of it, completing the cycle. I love that picture of the child that skins their knee, right? We know that it's not that it didn't hurt until somebody asked.
Right.
We know that it was safe to express the hurt when somebody asked.
Yeah. Yeah.
Yeah, that's a great image.
Yeah.
I think we can talk a lot more about this. There's a lot to be talked about. So put your questions, comments, and share them with us, and let us know what resonated with you, what didn't, what you might want to hear more about. We'll be reading this and following up.
All
Anything
right.
else, Michelle?
I think that's all. Thanks, everybody. Thanks, Dr. Spiller.
Have a good day.